Hello, I'm Jonathan from the YMCA and welcome to Be Well. Thank you for being with us today. I am very much looking forward to our conversation. For a lot of people in the medical community, top of mind has been boosters and flu shots and really separating fact from fiction. And so the hope is today that with Dr. Sayon, our guest, we will be able to have the opportunity to really answer any questions that you may have related to COVID, and where we are as a community and information about boosters, immunizations, efficacy, et cetera. So without further ado, I want to bring Dr. Sayon into the conversation, medical officer with the County of San Diego. Dr. Sayon, welcome. Nice to have you back again. It's been a while. We started this conversation last spring on immunization, so welcome to be back.
Thank you, Jonathan. Pleasure to be back, and I'm grateful that you're inviting me back. I'm happy to always share information so people can make the most informed decisions about their own health.
Fantastic. I know you and I were just talking about a lot of the disinformation out there and the impact of some of that. And I know you've put together a lot of slides that helps us get to the point of where we are as a community in terms of vaccination rates, immunizations. And so I'll let you go ahead and start wherever you'd like. And I think you wanted to bring through a particular story.
Sure. Yeah, I wanted to thank you, Jonathan, and hi everyone. Thanks for joining, and please feel free to interrupt me anytime with questions or clarification as needed. So I did want to start with the story because for better or for worse, many of us, respond emotionally sometimes more to stories, and that can help us and inform our behaviors more than just looking at data tables and facts and things like that, although this is of course based on facts as well. And so this is a story, and I'll send a PDF of this after. You can click on these links here, but this is a story about identical twins who were raised in Williamsburg, Virginia, but then ended up both working at the same car mechanic shop or auto mechanic shop or repair service center in Florida. These twins both had underlying risks for more severe COVID, et cetera, but they had ideological differences. One was vaccinated, one was not. One chose not to be. And there was an outbreak of COVID within their work setting. And so Bobby was infected, was one of the twins, and he was infected. He was vaccinated. He only had minor symptoms, no hospitalization required, nothing worse than that. His brother, unfortunately, Billy, who chose not to be vaccinated, ended up getting hospitalized and having a very severe version of COVID-19. Because of that, he ended up finally in the hospital and converting, so to speak, his beliefs about vaccination, really trying to persuade as many people as he could to get vaccinated up until the time he was put on a ventilator, and then he eventually passed away. So unfortunately, these are twins, identical twins, very similar environmental exposures, and even health profiles, it looks like and sounds like. But unfortunately, just that vaccine made a huge difference in one's life, really in both of their lives, and probably could have prevented, one of the Billy from passing away.
Dr. Sayon, that's a compelling story, and unfortunately, a tragic story, and one that we hear all too often. Where someone becomes infected, ends up, deteriorating in terms of health, and during that period of time is encouraging others to get vaccinated because they didn't, and then they pass away. So I appreciate you starting with that, and hopefully your words and information today will help move some of us that haven't become vaccinated to become so.
Thank you, Jonathan. And many of us may be vaccinated, but we may know other people who, just need a little nudge or just need some more facts, et cetera. And so feel free to share this information if that helps. And you're absolutely right. This is another kind of misinformation, that we hear a lot is that, well, we're counting COVID deaths wrong. And this is particularly important because just over the weekend, we passed 700,000 American lives lost due to COVID, right? It's passed more than the influenza 1918 epidemic or pandemic, right? And so even if we are not counting accurately, it's hard to deny, right? When you just look at all deaths of Americans over time, recent time. And so here, and you can click on these and they'll take you to the individual CDC reports of all deaths for those years. And you see that the deaths are pretty stable from 2017 to 18 to 19, maybe increasing about 20,000 a year. And then boom, right, 2020, unfortunately, you see this huge 500,000 jump of deaths, and about 500,000. And believe it or not, we actually only say, or the CDC only says that there's over 300,000 that are due to COVID. So, many folks actually believe that it may be undercounted, if anything, because you've had these instances where, for example, in early on, there was lack of testing. There were some hospitals overcrowding, like in New York or Washington State early on, and some people may have died of COVID, but never been diagnosed with COVID. So there actually may be more. Right. And it also speaks to why we're trying to prevent hospital overcrowding, so that people with, for example, a heart attack or something non-COVID related, get the appropriate care and don't get delayed or no care because the hospitals are overcrowded.
That's a staggering and significant shift. So very dramatic slide there in terms of the numbers.
Exactly. And I wish I could say it got better in 2021, but due to the winter surge and due to the more recent Delta related surge, it has, it's gotten better in some ways, but in other ways, we've continued to suffer as a society. So in terms of misinformation, I just want to say this is pretty much hot off the press. Just yesterday morning, some of my wonderful trusted colleagues and friends have put together a health misinformation panel. And the plan is hopefully to do this once a month or so, and really to look at, and these are, it's led by one of our county docs, but the other ones are not county doctors or nothing, to do with the government, so to speak. And they are bringing their own perspectives from their clinical view and really talking about a lot of the data. So I thought this was very informative, and it's just something for you all to be aware of. And there's a link to the YouTube channel. Okay, where are we right now? So the good news is that in California, we're actually the lowest. We're the state with the lowest COVID rates in the country. Puerto Rico is yellow, but otherwise, in terms of the 50 states, we have the lowest case rates. This one, I think this is Vermont. No, it's not Vermont. Sorry, my geography is bad, so please correct me, Jonathan. But there is another state I know that had a low rate, but it wasn't as low as ours when I last checked. And
how did we get to that, do you think? What's your perspective?
Yeah, so a lot of people say, well, it's because we're a high vaccinated state, and I think that's probably the number one most important thing, that we have a large proportion of our folks vaccinated in California. But there are other states that are just as highly vaccinated or even higher, and yet they have higher case rates or rates of infections than we do in California. So you can argue that while that is definitely probably the most critical factor, that's not the only factor. It's probably other things, right? Like California folks, students or people like my kids, they are required to wear masks in school. That's not necessarily a requirement in other places. There are still some other things for large events and gatherings that are required for over 1,000 people, things like that. So I think some of those different factors are playing into here as well.
Dr. Sayan, do you know what our vaccination rate is?
I do.
Awesome.
Yeah, I do. I'll get to that in just a couple of slides. Before I get to that, though, our case rate, I just want to say that there's kind of two stories in San Diego, depending on if you're vaccinated or if you're not fully vaccinated. So here it just shows, these different lines. The blue dotted lines is the county average for everyone. But if you break it out by not fully vaccinated, it's the orange line. And if you break it out by the fully vaccinated, then that's the green line. So you see this big difference, and it's about 4 times higher in terms of infection rates amongst those who are not fully vaccinated. So not zero in those who are fully vaccinated, but much, much lower. And that difference is magnified, really the amplitude is magnified when you talk about hospitalization rate. Just last week, this rate was actually 46 times higher, but now this week, we just update our slides every Wednesday. So these are Wednesday evening. So these are pretty fresh slides for the week or data. And you see that hospitalization rate for those who are not fully vaccinated are 23 times higher than those who are fully vaccinated. And then a good way to kind of visually depict it, and one thing I didn't mention also is that you see that the curves went up and they went down. So we are going, we have peaked in terms of the recent Delta surge. Here, this slide is from Tuesday's Board of Supervisor meeting, and it was presented, and I really liked it because it shows fully vaccinated folks on the left and then not fully vaccinated on the right. And since June, really the Delta variant has caused most of these, if not all of these. You see that there has been blue, hospitalizations and a few deaths in those fully vaccinated, but really you're nothing even, there was one in the 20 to 29-year-old hospitalization, but other than that, it's exclusively 40 and older versus, and then you see the height of the bars are much, much lower than here, and which indicates basically a lot less people are getting hospitalized or dying, and a lot younger people are getting hospitalized and even dying who are not fully vaccinated here on the right side. So I hope you see those differences. The average deaths of those who are dying from COVID who are fully vaccinated is actually 80 years old. But if you're not fully vaccinated, that number, the average or the median, drops down to 68. So there's a big difference in terms of who's getting infected and who's getting hospitalized and who's dying based on vaccination status.
Dr. Seon, on that last slide, anything you want to say about that first not fully vaccinated, the 0 to 11, that spike there, 81, is that, how is that coming about? Is that with children having gone to camp, returning to school? Is that part of what we're seeing there?
Yeah, we're definitely seeing infections in schools. In daycare settings, we continue to be. I mean, excuse me, in society, as we've all, opened up society as of, I think June 15th was when California opened up, we got rid of that tier system, and a lot of things went back to, normal, quote unquote, for a large degree. And so as people are gathering, if people are not vaccinated, and unfortunately the youngest of our residents aren't even able to get vaccinated right now. So, and that'll hopefully change. So there is, they can be contagious. The good news is that most of them you see here, there are hospitalizations, but no deaths, but hospitalizations are not insignificant. And even if you're not hospitalized, whether or not you're hospitalized, you could still get what's called long COVID. And so these are, right, and a lot of us may get COVID and suffer at home or something, but some of those people, it's estimated around 20 to 30%, and that includes kids can also get long COVID, and as well as some other things that kids can get, like something called multi-inflammatory syndrome. And then, but you can get long COVID. Like there are stories of people who, continued to have a loss of smell or taste, or can to maybe have some heart issues, or have some neurological issues, or have some continued cough or other issues that are happening, or or even brain fog or COVID fog, what they're calling it, things like that. So unfortunately, even if you're not you can't just look at hospitalizations, because people suffer in many ways, unfortunately, due to this disease.
Yeah, excellent point. Thank you.
Okay. And then this is just a way to graphically show that the blue here is when we genetically sequence all of our cases, or as many as we can, the overwhelming majority, almost 100% essentially, are Delta, the Delta variant right now in San Diego. So that is what's driving the cases. There have been other variants that have come about, like the Mu variant, the R1, but nothing seems to be out competing the Delta, right? And the COVID we're dealing with today is much different than the COVID we discussed a couple months ago when I was last here, right? And then to your question, Jonathan, in terms of how are we doing as a county in terms of vaccination rates? So by our estimations, almost 80%, the bottom number right here, bottom right, 79.4 folks are percent of those who are eligible, 12 and older, are fully vaccinated. So that's 4 out of 5 folks, who are 12 and older. And then almost 89%, or basically only 11% ish, have not even had one shot of a 2-dose series, or right, so they have, most people have been partially vaccinated. So even though we hear a lot of vaccine misinformation, or if you watch our Board of Supervisors, there's a lot of vocal folks, but that is minority of San Diegans. Most people, even across political aisles and across ideological aisles, have actually gotten vaccinated, right, to help our economy and really protect us as San Diegans and shielded us. And you can see that in the natural experiment that just happened with the Delta variant. Our hospitals definitely got very, very busy. We got on the brink of being overcrowded, but we were not overcrowded. We didn't have to, shut down society. We didn't have people with heart attacks, not getting treated, things like that, like other parts of the country, during the Delta surge, because they had much lower vaccination rates.
That's an impressive number, and it's very helpful to see. Obviously, there's more that we can do and will do, but that's impressive to see. Yeah, that's excellent. I know we talked last time about herd immunity, and so when I see a number like 80%, how does that play into quote unquote herd immunity as a society?
Yeah, great question. So, there was never an exact number for herd immunity. And some of the estimates, though, or some of the guesses and educated guesses, I'd say, were based on the form of COVID that was around earlier, right, which was much less contagious. So you can argue easily that because Delta is just so much more contagious than the prior strains, it outcompeted the UK variant or the Alpha variant, which already outcompeted the kind of the normal variant, normal COVID or the first COVID. And so this is kind of COVID 3.0, if you would, right? And so because of that, we really need as many people to be vaccinated as possible. And another thing is that, just because this many people are vaccinated, and this sounds very high, that vaccine distribution isn't equal when you look at it in different ways. So you could have groups of people, maybe parts of, and I don't have the map of vaccination by census tract in these slides, but we have that online, and you could see that there are pockets of the county that have lower vaccination rates. Just like that, there's also, when you look at race ethnicity, you see here that American Indian, Alaska Natives, and folks who are African American or Black have the lowest vaccination rates when you're looking at it by race ethnicity, or when you're looking at it by age groups. The 18 to 29-year-old groups have a fully vaccinated percentage of 56.6. This means that there's groups that were even eligible later than them, meaning the 12 to 17-year-olds, who are actually have caught up and passed them in terms of vaccination rates. And this group, we look at infections by decades. And so if the 20 to 29-year-olds are actually the most likely to get COVID, they have the highest infection rates. My daughter in the back, I'm sorry, apologize in advance.
She wants to participate in your
presentation. And part of your herd immunity question, though, has to do with, I'm sorry, has to do with oh, you want to say hi? The response also has to do with boosters, right? We know that there has been data shown that for some Americans, particularly older adults, the effectiveness of the vaccine in terms of general infection has gone down, but in terms of severe infection has generally been great, but and only gone down a little bit. Jonathan, any way I could pause for a second just to get
most definitely.
Okay.
Yeah, most definitely, please.
This is Clara. If you want to say hi, say hi, Clara.
Hi.
In terms of boosters, you see here on this slide, this is the recommendations that came out about 2 weeks ago from tomorrow from the CDC, and really talking about who should get boosters versus who may want to consider boosters. And so the should is where the data is the strongest, right? And that's particularly in the first dot point, which is people age 65 and older. Like I mentioned, the average or the median age of death is in 80-year-olds. Right, so that's why. And then they also added in settings because there's vulnerable people and stuff like that. So can you give me just 1 second, Jonathan?
Of course.
Clara, let's go to mommy.
At this point, is the only booster out there the Pfizer booster, or is there more coming? I know we had talked a little bit about that there's a pill that's coming. I will pause for a second, give you an opportunity to come back to us. Appreciate your patience as we have Dr. Sayon rejoin us in just a moment. His adorable daughter wanting to participate.
I am so sorry about that.
No worries at all.
A mouse in the process. That's my 2-year-old. Apologize. So sorry, you were saying about the asking about.
Is Pfizer the only booster that's out at this point in time? And I know there's others that are seeking authorization.
That is absolutely true. Yeah. So Pfizer is the first one, but there are others. I have a slide with the FDA timeline. It should be very soon this month that the FDA is meeting on both Moderna and J&J separately. And then I didn't think I finished the thought about the who should versus who may. You see here, the third dot is those adults who are 50 to 64 with underlying medical conditions. And that's particularly important because some of the data did go down to 60 that was convincing the CDC and FDA. So 65 is a little arbitrary. And then when we look at especially certain races and ethnicities that, when you look at certain groups, because of underlying conditions, their average ages of COVID hospitalizations are actually lower and deaths because of, as a group, there's just more health disparities in that group. So it is important. And then there's groups of who may receive a booster shot. And this is people like me, who's a healthcare worker, who are under 64, or people under 50 with underlying medical conditions.
Dr. Sayon, if I could ask a question, in an earlier slide, you had shared some of the disparities in terms of race and ethnicity, in terms of vaccination rates. How do we ensure or support getting accurate information out to all those different populations so that they can make an informed decision? And maybe they are making an informed decision. So I'm just trying to understand why we're seeing different rates of vaccination.
Yeah, a lot of it has to do with, what people are hearing and who they're hearing it from. And then, of course, where this is on people's priority levels compared to all the other competing interests in people's lives, right? If economic hardship is one of your main things, right? Getting a vaccine and taking time out of your day to go do that may not be your highest priority, depending on what you do and your other beliefs, etc. So I think there's a lot of motivators and there's a lot of trusted messengers. So we are the county, we can only do so much alone. So we definitely rely on partners like you all, but we also contract with a lot of community health worker organizations, like the San Diego Latino Health Coalition, different groups like that are trusted messengers for their own communities to really get the word out even further, or complement our message or layer our message further. And then, of course, we work with them and we'll set up vaccine sites and appointments based on where the need is, etc. I will say, though, now the vaccine's so widely available, really most pharmacies or doctors' offices are able to carry it, or at least refer you to somewhere else that has it. That's usually in people's medical home.
Right. Seeing some of the statistics in terms of hospitalization and death rates related to those that are vaccinated, seems like the immunizations have been the efficacy is very high. Just is my takeaway, non-medical doctor, but I'll give you that opportunity to speak to that, as well as what we project for these boosters in terms of providing that protection, so to speak, moving forward.
Yeah, I don't have that slide on me, sorry, right now, but you're absolutely right. If you look at the data, and it kind of based on how you look at it, right? Are you talking about vaccines preventing infection versus hospitalization? And it's, of course, arguably important to do both, but it's most important, in my opinion, to really prevent severe COVID, the type that lands you in the hospital or a funeral home, unfortunately. So we really want, and it's really good news that that's still strongly and extremely effective at preventing hospitalizations. So this is really just an extra boost, especially with the new variants. And some of this has to do with these variants like the Delta that do escape or avoid the vaccines a little bit.
Right. What are you seeing as upcoming? You mentioned there'll be a vaccination pill that might be coming forward. Okay, great.
Yeah. So if I can, before I get into that, Jonathan, sorry, it's just a couple kind of common questions we get, which I think we've already discussed a lot. For Moderna and J&J, I'll talk about that in a little bit, but it'll just be a couple weeks, and then you're still fully vaccinated, even if you don't get your booster. If you need a booster, does that mean the vaccines aren't working? No, it's that more that they're working very well to prevent severe illness, just like you just said. But there is some reduced protection, and this happens often in many vaccines. It's not clear that this is going to happen or be required every, how often. It really depends on the world. I think probably the most important thing right now is to get the whole globe vaccinated. If I was still in my birth country of Nigeria, even though my family is Sri Lankan, they moved to Nigeria, and it's like a 1% rate of being fully vaccinated. So sometimes we don't realize how lucky we are. This is what I just spoke about, but in a great visual format. And if this helps anyone in terms of, who is eligible for a booster dose here, 65, right? And then certain settings or different types of folks, may versus should. And then I didn't talk about it here, but if you're immunocompromised, this is not a booster dose, but it's actually a third dose. And that's because a booster assumes that you had high immunity and then it waned for whatever reason, right? Time and Delta strain in this case, in older adults, and then you need a booster to get it back up. Sorry, my hand's popping in and out, but immunocompromised, there's some good data that, especially those with solid organ transplants and some other conditions, that the vaccines didn't really take to begin with, because if you're immunocompromised, you may not produce enough antibodies, et cetera. And because your body does the other half of the job, that the vaccine starts the process, but really your body does the second half of the job. So I'll leave that with you. I can get back to this in 1 second, but just to answer your question, Jonathan, about sorry, here it is. Here are the dates in terms of when. So on the 14th, FDA is gonna meet about Moderna, and then the 15th, they're gonna meet about J&J. After this happens, they still need to, there's a process where the CDC still needs to meet, and then they have to finalize and update their recommendations.
Great.
But then going back, if it's okay with you, I'll talk about the 5 to 11-year-olds. That's a big topic. I think many of us are interested in.
Yes, it is. Thank you.
So the FDA, you see here on the 26th, they are meeting to talk about the 5 to 11-year-olds. And going back one step, so today was another big day, and for this purpose, Pfizer did submit their data. They had a press release a couple days ago, I think it was last week, talking about this, but they never submitted their data until today. They finally gave a formal application today on 10/7, as you see here. And then now the FDA is going to continue spending weeks. They're going to meet on 10/26, like I said, but then there's several other steps along that process, but these happen fairly quickly after that. So hopefully, by the end of this month, by early November, this will likely be authorized for emergency use in 5 to 11-year-olds. And they are looking, at least for Pfizer, it's a slightly reduced dose than the adult version or the 12 and up version. But it seems, at least their press release seems to indicate that you get a similar response.
Dr. Sian, what kind of information are you seeing related to side effects with boosters? I know it's early still, but you may have some information on that.
Yeah, nothing different is expected. It's the exact same vaccine and the same dose for Pfizer than it is in the beginning. I will say for Moderna, actually what they've been submitting to the FDA in terms of their booster, it's going to be a reduced dose for the booster. So that may actually lessen, especially some of the more immediate side effects, right? It's very common to have immediate side effects or likely within the day or two, arm soreness, maybe a light low-grade fever, headache, some things like that. But what's totally not common is these things, and this is gets a lot of attention. There are rare but serious side effects to these vaccines, and there's something called Guillain-Barré syndrome. There's something called TTS, which is a thrombocytopenia or blood clotting issue, and then myocarditis has probably got the most attention recently, at least for kids. And so I know there's a lot on the slide, but what it's doing is saying that when we took this information from a recent CDC meeting, and what they said is that for every million doses of vaccine given in the US, right, and you look at the groups most affected by these rare side effects, you will prevent this many hospitalizations, ICU admissions, and deaths, right? So 2,400, 1,363, because this is a younger age group. But and alternatively, you will have this many cases of these rare side effects, which we know how to handle, we know how to treat. Myocarditis especially, I just want to say that, you know, some people are observed in the hospital, but it's treatable. There's been no deaths due to this or GBS. Earlier on, there were a few handful of deaths related to TTS, which is the blood clotting, that got a lot of attention, and the medical community completely knows how to handle it now. So that's not something as concerning, but overall for the population, you know, vaccines are extremely effective, and these are really, really rare outcomes that do happen, and we do monitor it, but we know how to handle.
And I appreciate the transparency in terms of sharing that there is some impacts, but it's a rare condition, a rare incident, and medically we're more adept at being able to address it.
Exactly. And then just, I think this is hopefully starting to close these slides, at least from my hand, is that a lot of people are asking about, can I get the booster at the same time as the flu shot? It is flu season. We are seeing flu activity. We're definitely seeing more than last year, but it's really not a fair comparison, because last year, you know, society was really shut down in a lot of ways. And so we weren't interacting the way we are this year or in 2019, right? So it's expected that we're going to have a worse flu season. And the question is how much worse, and then what can we do to prevent it? And one of the best things we could do is flu vaccines, which are effective, and but not as effective as COVID vaccines, just to be honest. And but they're still the best public health tool we have, and you can get them both at the same time. You don't have to. You can choose to space them out, but you can. And if you do, they just recommend that you get them in different arms. And flu shot is available for anyone 6 months and older, you know, unlike the COVID vaccine, which is only 12 and older right now. And here's the data. This just came out yesterday, our first flu watch or influenza watch of the season. It's a weekly magazine that you can subscribe to. It's a lot of different data around flu, but we're already up to 167 flu cases in San Diego that we're aware of.
Interesting. What is your sense? No, quick question. What is your sense of the impact of all the information about vaccination and immunizations, and how that may impact positively or not people getting flu shots, other immunizations? Some could say that might support it, because majority have rallied and responded to healthcare information and looked at how to protect themselves. And yet at times it's been controversial. So I'm curious what your thoughts are.
Yeah, I think overall, most people, you know, want to do their part, want to protect themselves and their loved ones, and the understanding that these are not perfect interventions, but these are really the best things we can do. And I think it helps to frame and remind ourselves that there are plenty of things that we kind of make that decision on in other aspects of our lives where things are not perfect, but we know that's the best thing to do. For example, you get in your car, you put your seatbelt on. You get on a bicycle, you put your helmet on. You get a motorcycle, you put your helmet on. If you don't want to have kids, right, you may want to use birth control, things like that, where we know that these things may not be 100% effective. But if I'm going to get in a bike accident riding my bike and I get hit by a car, you know, chances are that if I'm wearing a helmet, I'm going to be much more likely to protect my head and my brain and you know, not die from getting hit by a car while I'm riding my bike. So I think, you know, there's calculations we make like that on a day-to-day basis, but we just may not know that or acknowledge that. And hopefully people can you know, keep that type of thinking in mind, and also that we're protecting the greater good, and that we have evidence just with this Delta surge that it wasn't as bad as other parts of the US, because we have a higher vaccination rate, in addition to all the other things we're doing to protect ourselves.
Excellent. Very, very good information. We have just a moment or two left. So I just want to,
Okay,
if there's anything
sure.
else that, you mentioned antibodies that you wanted to share something
Sure.
about.
Yeah, this just for anyone. I know there's a lot of discussion or debate, like for kids, oh, COVID isn't as bad as flu. It's worse, actually. When we looked at deaths, and this is the state data, it was actually worse in terms of flu deaths in pediatric population compared to prior flu years. Pregnancy, just CDC is just last week pushed out a notification saying that 97% of people, pregnant women hospitalized in COVID with COVID, were not vaccinated. And the good news is that there's more and more data showing that the vaccine shows that not only the pregnant women get protection, but they also pass it along to their baby through the cord blood. And then just a constant reminder, and this is where the YMCA does a huge role and has a huge role. We help everyone live well. And if that's exercising, getting sleep, de-stressing, managing your underlying conditions, eating healthy, these are all things that, we rely on you at the YMCA to really help our community live well, because we can protect ourselves from more severe COVID. But unfortunately, data are showing that it's going backwards. Kids have gotten unhealthier last year with increasing BMI. So these are, this is a good way to think about risk. Nothing's ever 100% safe or 100% not safe, but it's really how we handle it. In terms of monoclonal antibodies, if you or someone does get COVID, whether or not they're vaccinated, if they're 12 and above and they meet certain criteria, they could be eligible for what's called monoclonal antibodies. This is just another recent study in a huge medical journal, probably the best one, where showing that the risk of hospitalization and deaths were reduced by 71%. And so that's not perfect. I would much rather go into that having vaccine on board, right, which already most likely reduces your risk of severe COVID. But that is helpful to have. And then the other thing is that there's emerging data that hasn't been authorized yet, but there's probably going to be some pills, antiviral pills, not as good as the monoclonal antibodies, 50% here, as you see here. But this study was stopped early because it was so good that they stopped it early to submit the data. But and this is the last slide, Jonathan, is that, when we think about COVID transmission, some people are saying, well, okay, well, what's the point of vaccine if I can just get monoclonal antibodies or take these pills later? And it's really, understanding that vaccines have this broader impact. And by the time you get infected and you are eligible for monoclonals or a pill in the future, right, you've already spread it to other people, whether or not you have symptoms, right? You're contagious up to 2 days before you get symptoms, if you get symptoms at all, right? So you've already spread to your loved ones, your friends, your families, your coworkers, whoever, right? And you can help larger society, and you can help your own chances of survival and better outcomes by using vaccines, right? And you cannot spread an infection you never get. So if you don't get the infection because you were vaccinated, you're stopping and interrupting this whole chain that you're seeing on this slide here.
Well, Dr. Sayan, you brought through really a powerful argument in terms of data research. The slides really dramatize the benefit of immunization and boosters moving forward, and really hopefully compels us to do our part to take care of not only ourselves, but those that we love and in our community. So I really appreciate the information. I know you're going to make available this slide deck so that we can share it with those that came and joined us today. I appreciate the work that you're doing to get out accurate information and help separate out fact from fiction. That's been very valuable. I know you've also, on the final slide that we'll pull up in just a moment, there's a resource there, a website that people can go to get information in real time. Anything that you would like to just share in closing?
No, I think I've said more than enough, and thank you, Jonathan, for echoing and helping translate, so to speak, and really appreciate everything that you all are doing. And hopefully we have more than enough information to help you make responsible choices on your health and your loved ones' health, and talk to other people. continue to follow and go to our website that's listed here. Watch that misinformation webinar. We have a whole page dedicated to misinformation now on our website that you'll find as well, if you're interested.
Fantastic. I appreciate you empowering us to be those advocates in the community as well. So Dr. Sion, always a pleasure to connect with you. Please be well. And all of you that joined us today, thank you for your attention and to this topic. And until we meet again, please be well. Thank you very much.
Thank you.